Hello, my name is Steve Carpenter. Today is the 24th of July, and for my course presentation for EVSP 560, I've chosen to research the impacts of cadmium in wild game animals, specifically the white-tailed deer, and the potential impacts for human health issues from consumption. The white-tailed deer focus for this project was chosen as this species is the most prevalent and sought-after game animal in North America. This research project was chosen to determine potential health risks for the increased exposure to cadmium through consumption of wild game, specifically the liver and kidneys. The primary focus for heavy metal exposure through the consumption of game meat has been heavily focused on the exposure to lead, primarily due to the fact that the majority of ammunition used for hunting is composed of lead. With so much focus on lead, several manufacturers and many hunting enthusiasts have decided that the use of lead alternatives and lead-free bullets is the safest way to reduce the exposure to lead in game meat. However, there are many other heavy metals that can be just as damaging upon ingestion, such as cadmium. The data for this research was collected through the use of the APIS library and Google Scholar. Multiple articles were used with cadmium and game meat as the primary keywords selected, as the available amount of researched information specific to this topic is small. Most studies were not cadmium specific but generalized on all heavy metals to include lead, copper, chromium, as well as others. For the testing for cadmium, most research used tissue collection from game animals harvested through hunting, killed in vehicle collisions, or killed for other reasons such as nuisance animals. These tissue samples were then tested for cadmium and other heavy metal levels. A large number of the research was focused around areas with mining activity, either active or inactive, as mining activities show increase in exposures to heavy metals. What this research showed is that wild game animals tend to store cadmium in their livers and kidneys, with kidneys tending to have higher levels. Skeletal muscle and bone tissues that were collected in several studies showed no significant increases in cadmium levels when compared to background levels. Liver and kidney tissues were most affected by cadmium exposure, and most species that were researched, such as white-tailed deer, moose, elk, and mule deer, showed bioaccumulation of cadmium, showing that as animals age, the levels of cadmium in the liver and kidneys continues to increase. It was also found that there were differences in males and female cadmium levels, which also fluctuated depending on the time of year. One of the other concepts for this research was how does the cadmium work its way through the food chain, and how does the food chain impact cadmium exposure? For the most part, this question is unanswered as there is much more research required to fully understand how the food chain or web is impacted by cadmium and how much it moves from one species to another. A study by Larison et al. In 2000 discovered that willows were biomagnifying cadmium in their tissues. The cadmium level in the willows were found to be 2 to 3 times that of other species in the same foraging area. This poses a particular problem for several species, including elk, moose, and white-tailed deer, as this is a preferred forage for these species, exposing them to increased levels of cadmium. With cadmium accumulation being concentrated in the liver and kidney tissues of game animals, consumption of these organs should be limited in both quantity and serving size. As many studies on white-tailed deer show bioaccumulation, only the liver and kidneys of younger harvested deer should be considered for consumption, as older deer will tend to have higher levels of cadmium. Some research indicated that children are more susceptible to cadmium exposure and should consume less liver and kidney by body weight as adults, as cadmium exposure can lead to several health issues including kidney damage, reproductive issues, liver damage, and various cancers. Most of these human health issues have been studied from industrial exposure to cadmium through both inhalation and ingestion, but very little has been done for exposure from game meats. Future research is required to determine how cadmium exposure from game meat directly affects humans. It is also important to note that many people use game animal organs for dogs as part of raw diets. Liver and kidney should be used less as the exposure to cadmium to dogs could lead to health issues for them as well. The biggest gap to this research is finding the pathway of exposure to each species through the food chain or web, with some of the research showing that cadmium levels fluctuated based on sex and time of year. Based on the time of year, some species, including the white-tailed deer, will change their foraging preferences based on the needs, whether it be proteins, fats, or carbohydrates. Understanding better these preferences as compared to the cadmium levels of available forage will help to better understand the food chain impact. However, most of the sampling was completed in conjunction with hunting seasons where access to animals was easier. Collection at other times of the year could prove difficult, as only animals killed in vehicle collisions or nuisance animals would be available for sampling. If capture, biopsy, and release proved cost-effective, it could be a viable answer to this lack of available sampling and allow for year-round results to better understand the food chain. Clearly, the impacts of cadmium and other heavy metals exposure through game meat are under research but can have devastating human health impacts if exposure levels are high enough. As previously mentioned, most research on this impacts of lead due to its use in bullets. As important as that is, the study of all heavy metals needs to be better understood, not only for human health, but for the health of all species.